One of the things that we knew we needed to do was we needed to find out how many of our current health department employees really wanted to go back and enhance their education and training. And so I will tell you at this moment in time, and I know I'll get questions about this, it is super important to have a solid partner. All right. So get your questions ready for that, because I'm telling you, without Dr. Ashish Joshi, who is in this picture with me at University of Memphis, he is the Dean of the School of Public Health at University of Memphis. He came in as Dean around the same time as I came in as Director. And I'm telling you, there are portions of this program that just by sheer will that just wasn't there before, we've been able to get this off the ground, and we're planning even more. And so partnership couldn't be even more, any more important. And when I told him that we wanted to write for this grant, and one of the things that we wanted to write in this grant was that we wanted to send our current health department staff back to school, he was totally on board and said, listen, tell me what we need, tell me what we can do. And it's just been a great partnership. Next slide. So logistically, what did we do? After me and Dean Joshi got together and got our teams together, we figured out that these were the eligible programs that folks would be able to apply to. So these are the programs that are available at the University of Memphis's School of Public Health program that we wanted to see how interested people would be in these programs. So there are master's programs, there's a couple of PhD programs, and there are several graduate certificate programs that people could qualify for. And then of course we had to talk about and get agreements in place that even though people may be interested in these programs, they would still have to meet the requirements for admission to be admitted into these programs. So that's an important point to say. But what I can tell you is Dr. Joshi was very instrumental in making sure that our employees had a smooth process in applying. Next slide. So the selection process, and this, when I talked about this in Chicago in May, a lot of people couldn't believe it. So we have a staff of between 500 and 700, depending on what day you're talking about and how much turnover we've had. We sent out a survey to the entire health department staff, seeing who would just be interested in any kind of degree program within public health. And I will tell you that 250, and at the time it was about 500 employees. So about 50% of our employees expressed interest, right? And so what we did was we had a really tight process. Okay, you're interested, but now you have to take the initiative to apply, get all your stuff in, meet the application requirements of the school, and let's see how we do. And out of that 250, 18 ended up applying and were accepted into a School of Public Health program or a nursing program. And so we're super excited about that. And what we had written into the grant was that University of Memphis was our partner, right? And we also wanted to make sure that these employees on acceptance would also be able to receive, in addition to their tuition being paid for, a student stipend to mitigate the costs associated with returning to school, which University of Memphis supports. And so I will tell you that this has been huge for our employees, because as you know, a lot of our public health employees are not in it for the pay. They really are in it for the work and the passion. But going back to school is a huge commitment. It takes a lot. Sometimes you're not going to be able to cook dinner for your family. Sometimes that house is not going to get clean. And so we knew that we needed to write within our grant something that would allow these students to offset the cost of being a full-time student and still a full-time employee as well. Next slide. So some of the details of the program, and we're getting toward the end of the presentation, so I hope you all have your questions ready. Our employees have maximum flexibility in their work schedule on class days. And please understand, these are employees that are still working full-time and they're going to school. And I think the only requirement is that they're taking at least 2 classes towards their degree program, at least 2. But I know a lot of them are taking more than 2. They have maximum flexibility, but that doesn't mean that the work that they have here at the Shelby County Health Department isn't getting done. It is, and it's just been great. A lot of the employees are taking several of their classes together as a cohort, which has been huge. And they also have a dedicated space at the University of Memphis to study and complete assignments. And I will tell you, one of the greatest joys I've had in the last couple months was one of the traditional students from University of Memphis School of Public Health came up to me at an event. And she said exactly this. She said, listen, I am a second semester graduate student at the University of Memphis in the master's program. And she said, my first semester was so much different from my second semester, and I wanted to let you know why. Because you allowed your Shelby County Health Department employees to come in. They have been in my second semester classes. And she said, they are just a wealth of knowledge. She said, it is so nice to hear the theory of what we're supposed to be doing in public health in class, and then turn around and they tell us what that looks like in practice. She said, a lot of these people have like 10, 15, 20 years of experience in public health, and we would have never gotten this if they weren't allowed to come back to school. And so I will tell you that it has paid off. Our employees, our 18 employees that are taking advantage of this program are super excited about the program. A lot of them are in this picture actually, and I'm seeing this for the first time, knowing that a lot of them are in this picture. But it's just been a great experience for our employees, but it also has enhanced the classroom experience for all the students at the School of Public Health at University of Memphis.